Hi, everyone. Good afternoon. Thanks for joining us. I'm excited to see so many people on the line and here in our webinar classroom. This is Anna Ricklin, and I'm the manager of APA's Planning and Community Health Center at the American Planning Association in Washington, D.C. I'm really excited to launch our research forum as part of our Plan4Health project today. This session on active living and active design is our first webinar launching the research forum, sharing data and results of research from members in our community of Plan4Health and other members across the association who are working at the intersection of planning and health. For those of you who don't know, Plan4Health is a project sponsored and supported by the Centers for Disease Control and Prevention and is in its second year. Our presenters today will represent representatives from our first cohort of grantees as well as our second cohort of grantees. So it's going to be a nice cross-section of work that's emerging and completed and ready to be applied, and I hope that you all learn something new. So our first speaker is Milena Bernardidello from the city of Madison, Wisconsin in the Planning Division. Milena is a healthy community planner with the Madison Planning Division, and she joined the city in 2013 as in that role. She earned her epidemiology master's science degree in 2012 and her urban and regional planning degree in 2013, both from the University of Wisconsin in Madison, and she is currently a PhD candidate as well. Milena moved to the U.S. in 2004 from Europe with a technical degree in industrial chemistry, and then in 2008 she received a bachelor's in sociology and global culture, so she is very cross-trained. As a researcher, she focuses on non-communicable diseases, and as a professional, she works on creating active living communities for all generations with an emphasis on disadvantaged populations. Milena specialized in GIS-based epidemiology and works on the correlation between the built environment, food accessibility, and health outcomes. She also works to integrate health and equity into planning processes and the development of web-based planning tools for decision makers and communities. And that's what we're going to hear about right now. Milena, it's all you.
Good morning, everybody. Thanks for joining us in this afternoon and wanted to learn Active Living Index. I'm hoping that you can see the screen now since we are getting through some technological challenging yesterday. So here is the screen that you see when you open up our Active Living Index using the link. And that's the first page you see, and it's describing what the Active Living Index is designed to do. We call it purpose, and mainly you can read at some point when you're going to have time, but I want to emphasize this part that is an assessment tool, and it's designed to evaluate how conducive to active living a place is. So when you get in, you can click on it, and it's going to go on the baseline map. This is an interactive tool based on ArcGIS Online, for those of you that are not maybe familiar with this platform, and that's the kind of baseline data you can see. We designed it in a way to have this, how to use this map up front, so everybody can have immediate possibility to understand how to use it, and you can scroll up and down and give you some hints step by step how to use it. It can be closed right away and can be always reopened at your convenience if you need additional information. So we thought it would be a useful tool. The map appears this way to make it faster, but we are going to zoom in a little bit closer, and we are going to see the extent of this project. The project was a county-wide base, so we collect data for all the base information from the county, and it also goes deep at the level of address. One of the strengths of this tool is the scalability, and we can see how to use it now. Here on the left part of the screen, there are the classic tools that ArcGIS Online makes available. This is going to show you how the active living score it comes into be in terms of color code and in terms of range. We are going to see a bit later in the presentation of in the PowerPoint that I put together for you what is behind the scene and how this score came into be. But one of the characteristics is that this score is designed to have three main components, which are measuring the walkability, the bike accessibility, bike system accessibility, and transit system accessibility. And those are the three main components of this index, which are also creating some scores. All of them has also some subcomponent that we are going to see now how to use and which kind of answer they can help to provide depending on certain questions. So in here we can see how to use it. This is the active living score again, like you saw it before, and this is the color coding you see here. If we can zoom in certain area, we can go closer on this particular part of the city. I'm going to go in this area over here because this area has different variety of colors, so you can see a little bit better how this is going to be applied. Let me see if I'm in the right spot here. Okay. And so we can get a little bit closer so you can see also the street layer that is behind the scene. This is designed mainly using a street network structure. So here's the color code. You see what it scores. Now we can close this part temporarily. And if you want to see what is underlying this, we can use this sweep code. This one is a tool that is available on the ArcGIS Online. And when we use this part, we can select view to see what is underneath. And okay, here. And then we can use this bar to go up and down and see what is underneath our score. So we can start to see what the score is. We are going to be here, for example, in this area. Clicking on every part of the map, you can see this pop out coming up. And here we're going to see the score. We see here this particular area is scoring 55.2 out of 100. I want to point this information right now. We're going to see some detail about that later in the presentation. The walkability, bike system accessibility, and transit are the three components I was mentioning before, and under each of them you can see the subcomponent that are creating the score that is able to give you a sense of how they play together in giving the total active living score. In each of them, we are going to see the layer visually of what is so practically creating this number. We can start from the beginning. I'm almost generally prefer to focus on walkability, so we start with that. And so in here, we can move our bar back temporarily. You can still see the pop out. I'm closing in a moment, and we can start to see here the destination. They are one of the subcomponents of the walkability score. If we want to see how many food-related establishments are in our area, how many education-related establishments, how many parks, how many recreation places are here, and how many shop or other service or healthcare-related establishment around here, we can click all the layers like we usually do using GIS, and you can see them all. The importance of this is, I want to highlight this point, there are 5 of them, there are 5 categories. We can see later what that means and why there are 5 and what they are. But the thing is giving you a sense of what is around this particular area. So going back a second here, and going back again here, we can see that was the score. I'll pick another little corner. I mean, it changes really the micro scale. This destination density says they score 26. Let's see what is around here. We saw the single destination. Now we can see, using the layer, what that destination density is telling us. And here what we see, so again, here's the total score. Here is the score of only this subcomponent and what it combines them. What we're measuring here is the destination density in terms of the variety of destination, not the number of destinations. It's a subtle difference, but it's slightly different than other kind of tool that you see sometime out there are using as a rationale. So here we see, for example, this one, just clicking on the specific place, this is a restaurant. Here we have a farmer's market. So we can see also the type of food-related destination. In this particular case, I'm focusing on food, but you can see on other things. This is an education, that's a university. Here you got the theater, right? You see where you can go. And so the point is, more places you have the possibility to go for different reasons, more possible is that you can be active and physically active. And so this is telling us who's scoring 26. Why you see the color here? Again, it's the same structural color scheme. The categories are much larger than the active living destination category. Each subcomponent has its own criteria, but it can give you a sense of how they interact and how it's going to be scored. This, for example, we were here, like we saw before, and again, we are scoring as a destination density 26. And you see also why. There is different types. There are different types of destination around here. So the next question can become, how can I move around there? Can I move there easily? So I'm unclick this part. I'm still seeing the destination, but I want to see how I can move around. And so again, we can keep going back here, see your score, go in here and see this particular sub-score, sub-component of the score, which is indicating the intersection density. So going back to our, for example, farmers market, up, although it was the restaurant, a farmers market up here or this other place with a theater. Can I get there walking? Is it easy for me to move around by walking around that place? And looking at this intersection density, so what is around in terms of the built environment infrastructure that can support my choice to be physically active. In this case, those two destinations are low than average. As you see the score here, and that changed the color also scheme, you see they're not ideal. They're not bad, like if you were sitting, for example, here, that going to this park is not ideal, but going to this theater or this farmer's market is relatively easy by walking, because the intersection is supporting that kind of mobility. We can also see later on how many people potentially can get there. Because another of the subcomponent is the population density. Population density is always important because it supports either the establishment per se, but also the number of people that can use the infrastructure close to it. This is not a very high dense area. It is sort of average the area. So the people that are potentially here, they can get easily there. We saw the intersection, but there are not too many that can get there. There are more people here. So again, you go back, look at your score, see how much was scoring. Population density was 1.5, clearly, of the 5 that you can get, lower than the average. And so this is one of the options can be used. Then we can go on another type of mobility here, and if we look at bike, can I get there by bike? Would it be easy for me? And so I can look at the bike facility density. We are looking at here at premium facility. And again, here we can see that the score is not very high for the quality of the facility, and there are specific ways to categorize. I can explain later in the QA session if someone wants to know more about it. But this is already given an indication, not ideal for biking or having an easy access structure to bike there. Also here, another information is the bike level of service. That's the network, so how many bike paths I can get there, or bike trail. And this is not bad. Again, something a little bit lower than average, but potentially if some improvement can be made, that's an area that can be reached. Again, not ideal, but average. Potentially if I don't bike and the only option I have is to go there by transit, we can also see how the transit service is supporting or not our possibility. And again, we can still see your score at any moment. You can go back and see the other layers. See, this is a very good area for transit. The transit accessibility here is very good. So you might have a sort of average way to get by walking, not ideal by biking, but very good way to get there by transit. The transit system accessibility here is very good. It goes down, of course, the farther you go from the main road, like we can expect, but overall those locations here and those locations here have very good accessibility by transit, which translates that the people we saw here living here, they are in a very good spot. They can have access in many different ways. More you far away, you can have a certain other level of service for you. And lastly, the last option we can have through this index is to see the percentage of jobs that I can have access to by transit in 45 minutes. And again, here you see how red is this area. We correspond to this range group, definitely higher than the average, is very well served to reach other job location. If we can zoom a little bit farther away, you can see how the distribution of this particular one, this particular information is moving around the city. So from here, if I live close to this place, I have a higher percentage of jobs that I can reach in 45 minutes by transit. So that in some way is giving you a sense of how this tool can be used, what kind of answer can be provided. The point is, if there are any intervention that a planner or a planning department can make, or the community wants to ask, this is an assessment tool. They can understand in which of those 3 mobility areas there are more needs for certain intervention than other, and potentially which of them can be feasible. You know, not all of them can be feasible, but if there is a way to prioritize them and putting more attention in one than another, that is a perfect tool of understanding, is exploratory, and is easy for everybody, either policymakers or community members, to get access to it and scroll back and forth on their discretion and their own time. The only need that is required is an internet connection, which ended in a situation in which some population potentially don't have it, but the library now is supporting that too. So that's why we decided, of course, to put it available. The only next step we are going to need to have the complete implementation of that is to have a landing page. So if you Google it, then it's going to be there for you. That's the last step you have to focus on in terms of technical part to complete this project. And with this, if there are no specific questions in this moment, I can move on the PowerPoint. Anna, would it be okay?
Looks great.
Okay, so let's see what is behind the scene. So again, this was came into be as a Capital Region Healthy Community Coalition that was put together in Dane County, and the grantee was the Capital Area Regional Planning Commission, and the City of Madison, which I belong to, was one of the main coalition members, in addition to the UW Family Medicine, University of Wisconsin Family Medicine, which provide us health data, and the public health department of the city, which is also county public health department. So we have a coalition that is more institutional in some way, but it was a very strong coalition to put together this project. And again, the Active Living Index per se as a tool, it came out from this grant and a previous grant, and mainly we want to answer this question: do I live in a place conducive to active living? And that was what was triggering all the development of this particular tool. As we saw briefly, the structure is designed to provide, is supported by current data, and is designed to provide a current status of a place. There are three components that are characterizing it: it's walkability, bikeway system accessibility, and transit system accessibility, as we saw, and the seventh subcomponent, which we saw before as a layer in the tool in itself. Again, the main point here is designed to provide descriptive and comparative analysis, and that's what this tool is able to do for those that are using as a viewer. Here is a reminder of what we saw before. We have on the left part over here all the subcomponent layer we saw that pop out with the independent scores and the total active living score and the active living score range per se. In here, we are going to see the structure behind the scenes. So I want to highlight the distinction between an index and a score. There are some confusion around. I want to make sure that we understand the distinction of them. This is the index. This is how we designed this structure and what we are measuring with this. And as we saw before, there were these three subcomponents for the walkability, bike system, and transit system. But the key part of this are those numbers. 75, 15, and 10 are the weight. The weight is extremely important in an index because it's an aggregating measure. And this index is the aggregating measure of three mobility components. But they are not the same, they are not of the same importance. Walkability is more important to promote active living than a bike system or a transit system. And there has been discussion around this way to weight them, but the important part here is understanding they are not the same and they don't count in the same way in the final score. And then we can see here in this part, oh, I'm sorry, I'm losing my mouse. There we go. We can see here the active living score. I want to highlight, as you saw before, this was supposed to provide you a total score of 100. But in the active living score in here, as you notice, there is no 100. Reason being, as in the walk score that everybody is familiar with, that 100 you sometimes saw is not real. It's a mathematical algorithm that stretched the score to reach 100. And we decided not to do that because we don't want to create a fake gold standard to which everybody in the county is looking at, We want to make understanding everybody that every place has room for improvement. And so we are just providing the real score of that place. Even the best in Madison, the city of Madison, can have room for improvement. And that's what we decided to do. These are the sub-score that you saw before and the layers that the Active Living Index ArcGIS Online is providing for you. I want to highlight this part, which is the destination density. We saw it before. We saw all the dots on the map that are identifying that. But conceptually, this is a key point because destination density are different between different populations. People interact with the built environment differently depending on their age group. And we're going to see why this is important. Here is the destination feature. And again, this is only that subcomponent. And I want to stress this part because we decided to classify, again, with this concept of weighting differently different things. We created practically two categories, primary and secondary destination. And the reason being, if you have in your environment those three destinations, food, education, and greenery, and I call it greenery because not only parks, but whatever is green, including trees or little open space, those are the main components that are supporting your health. The food you put in your body, education in your mind, and then you interact with the built environment to support your mental and physical health. The rest of the destinations are places in which you can entertain yourself for different reasons, but not as a primary need. They can be temporary in terms of time. They can be temporary in terms of seasonality. They can be temporary in terms of the usage per se. They are not conducive to active living by default like the first three. And I want to have everybody understanding this part. And that was scoring the most. So to use in all of this structure, we decided to apply it like the grant was requiring and identify some places that are potentially active living places. And we decided to use, as a planner, one of the main criteria was the urbanicity level. Urbanicity is problematic, but is also an answer for certain conditions. And so we decided to stratify by urban, suburban, and rural. Here is the urban area we decided with this particular project to focusing on. And I put up here, as you can see on the right, the active living score of that and the range. Why the range is important? The range is telling you that because of the scalability of this tool, that you can go down to the address level, within that particular boundary of this particular neighborhood, you can have variety. And understanding the variability within is important to understand where potentially you can improve, but which is potentially your maximum in this moment. So making more homogeneous, making more heterogeneous the system and moving between these concepts is supporting the whole population there to reduce potential disparity. And with that criteria, we did the same, identifying a suburb, which is here. Suburban communities are complex to conceptualize as a suburb, and the score in particular for the active living is vary a lot. And that's an urban and rural community we identified. We can talk more about this particular way to interpret the active living that I'm showing here, but it was just to give you a sense that sometimes the active living score as aggregated number is not giving you the whole answer. There are more information that you can capture to have a real understanding of the current situation on the ground. And then we use the same structure for the healthy eating, for supporting the food. What you see here is the destination density and also the food-related places that we are seeing before in the demo. And those are the two communities we identify, in which this one on the right, where the South Farmers Market is, did have something, but not necessarily fresh food. And here when we enter in the quality of those food destinations. The other area on the right is located in a part of the city that doesn't even have the general food destination, the general food store. And they creating a coalition, a co-op, to put together their own grocery store. So that was helpful for that, to help the community as a whole. And here is the last part in which we also had the strength to try to connect the active living index and specific health outcome. And here is where the UW Family Medicine was practically instrumental to provide the information, the data. We had this wonderful set of data at the block group level, and we decided to focus stratifying by age. And here it comes back the concept that people at different age group during their lifespan interact with the environment in a different way. And we decided to test childhood obesity prevalence and tested to see if the active living index was correlated to that. And we understand that from the statistical analysis that the correlation was very high, obviously negative correlated, but also we decided to see if there was any way that the active living index was also a predictor of variability of childhood obesity prevalence at the block group level. We are not talking individual here, we are talking about the place. And we, in the analysis, identify that even though the statistical analysis is at the beginning, so it's a preliminary result, but it was very promising because the active living index was able to predict 13% of the variability of the childhood obesity prevalence at the block group level. Also running the three components by themselves, the walk score, the walkability component was the one that has the higher effect. And so if there is something to focusing on first, would be that. Also controlling for multimorbidity, because there are other health conditions that might preclude individuals to really interact with the environment in a proper way. We test for asthma. Asthma is one of the conditions that is potentially not supporting an active living lifestyle. Even controlling for that, the active living index was able to predict variability in childhood obesity prevalence. That was really promising. We did a second test looking at adults and looking at type 2 diabetes for adults. Type 2 diabetes is extremely important to focus on because we are seeing children developing this disease. And it's a very detrimental and chronic disease. We don't want to have children in the next generation with this problem. So again, active living index, highly correlated, negatively correlated with type 2 diabetes prevalence at the block group level. And again, in regression, also able to predict the variability of it. And also even higher percentage, 25% of the variance between block groups of the type 2 diabetes prevalence. And even controlling for asthma, still the active living index able to predict variability in the type 2 diabetes prevalence. And with this, I'm going to wrap up. Substantially, the active living index, as we saw, is an assessment tool per se as an interactive tool, but it is also a framework. And it's a framework for policymakers and also for the community to have a health and an equitable built environment. I want to just bring this one here as a note. The City of Madison also developed other planning tools. If you want to know more about this, you can send me an email. I can provide more information. But one of the points is to evaluate across time if our interventions are effective or not. And so with this, I'm going to close, and I'm going to open for question or discussion later on. And I think now we are passing the voice to Michelle.
Thank you so much, Milena, for that detailed overview of your tool and the background research and the motivations for doing it all. It's good to hear about in more detail. So while we're switching over our slides, I want to encourage people to type in their questions and comments in the chat box that you can see on the right-hand side of your screen, where we can begin to track questions to ask our presenters at the end of their talk. And now we're going to switch gears a little bit and hear from Michelle Eichinger, who is president of Designing for Health. Michelle started with Designing for Health as an advisor and has now moved into the president role for the organization. She has over 10 years of experience in program development, management, and evaluation, as well as policy analysis. And she's helped out with training and technical assistance in both the public and private sectors. She's completed numerous rapid health impact assessments, or HIAs, for comprehensive plans and site development plans. She's recognized for her skills in public speaking, group facilitation, interagency collaboration, as well as capacity building. Most recently, she's assisted the Centers for Disease Control and Prevention in providing subject matter expertise and integrating public health and land use planning for the Communities Putting Prevention to Work program, which is one of the predecessors, actually, of the project we're working on now is Plan4Health. And Michelle has a Master of Science in Health Promotion and a Master in Public Administration with concentrations in organizational leadership and health policy. And I'll also add that, as you can see on her opening slide, that she's currently working on Plan4Health project in Delaware. So Michelle, it's your turn.
Thanks, thanks Elizabeth, thanks Anna for having us on here. Can you guys hear me okay?
We can, yes.
Okay, great. So I wanted to provide just a brief overview and some preliminary stuff that we're doing in Delaware. We are part of the cohort 2 for the project for Plan4Health, and so we pretty much just started a few months ago on this work. And so just to give you an idea of what we're doing, our task for the Plan4Health project is to create a systems approach change into how our comprehensive plans are updated for both the city of Dover and Kent County. We wanted to leverage the opportunity of when the comprehensive plans were scheduled to be updated, which is, I believe, for Kent County is 2017 and for the city of Dover is 2018. And so we took the opportunity to, with Plan4Health, to leverage that to change the way we want to update the comp plans for those two jurisdictions. And so as a Plan4Health project, we want to create a model to ensure that health and equity are integrated into this planning process, and create a model that addresses opportunities for physical activity by increasing access to parks and recreation, improving sidewalk, bicycle connectivity infrastructure, as well as healthy eating by increasing accessibility, affordability, and availability of healthy foods, and then also improving our land use patterns and urban design to facilitate more of that active living and healthy eating. And so that's the gist of this is to look at the comprehensive planning process and focusing on health equity as the driver in the planning process. So in part of this, the big part of this process actually involves a health equity analysis. And when we were coming up with the idea of what does that look like? How do we analyze health equity in the terms of the planning update for the comprehensive plans? We wanted to create a tool or leverage an existing tool or something to look at equity. And so part of the health equity analysis is part of this, more of this the scan of equity across in the jurisdictions, as well as taking a deeper dive into the community by doing a community survey that will help us leverage that information to get a better feel of what the landscape says. And so when we're developing the objective, we're developing the tool, we wanted to prioritize equity as, to identify these equity hotspots. And so we also wanted to create something, a tool that could be also used over time so that we would have this scan at the very beginning and then be able to take a deep dive at the community level to get a more closer look of equity issues in healthy eating and physical activity, apply it to the comprehensive plan, and then in time, when the comprehensive plan is scheduled to be updated again, we can use this tool again to see where we are and what progress has been made. And so again, we wanted to create something that looked at equity as the priority lens and then to be able to use over time. And so we were looking at different strategies of how to do this. And again, our focus is on healthy eating and active living and with that equity lens. And so we started to come up with a couple different tools that we would integrate into a map. And so the first tool is our equity composite score. So we're looking at how our communities, what does the equity scan look like? And so I'll talk a little bit about that. What does our food environment look like? And then we would lay that over top of our equity composite scan, and then also more of the active living where we're looking at park and open space density and active transportation. So to start with the equity composite score, we got the idea of this actually from some of the work that I did at the federal level. So in some of the federal funding applications, part of the scoring process looks at a percentage and average of equity factors. And so in this case, we took some of the most leading categories that contribute to health disparities or that are associated with health disparities that are contributing to the health inequities. And so we took the percentages of seniors, so that's populations of 65 and older, children, which is ages, I think we have from 5 to 17, household, percentage of households with income of less than or at 200% federal poverty level, non-white populations, households that are on the Supplemental Nutrition Assistance Program or food stamps, households with no vehicle access, and then households with a limited English-speaking language proficiency. And so we took the percentages of those by zip code, which was the easiest way for us just because well, first of all, just to give you a background with Delaware, Delaware is only 3 counties big, so it's a pretty small state in comparison to most states, and our counties are relatively small to begin with. So we took it down to the zip code level, and then the data that we pulled from to get those percentages of those demographic categories, we pulled that from the U.S. Census. And so each of these percentages, we took the score as an average, so that you have an average of all of those by zip code. And so the idea is that the greater the score, the greater the equity priority. And I hope that makes sense. So if there's more, higher percentage of these equity or potentially equity issues, that's where we want to target some of our planning efforts. And so by looking at it from a math perspective, and I hope you can see that, so we created this, we took the values for each of the zip codes, and just to give you a perspective again, we chose Kent County. One reason was the comprehensive plan update was scheduled. The timing was just perfect, but also of the 3 counties, Kent County often has the least resources and also has the highest obesity and also the poorest health outcomes compared to the other counties. So it has different challenges. What you see here are the zip codes that have the highest, or the different tiers of equity, of those equity composite values. And so the darker the darker the zip code indicates the higher the percentage, so the higher the equity need. As you can see here, City of Dover is dark red, and some of the white patches, you see a couple, I see one big white patch, well not really big, but we did not include the Dover Air Force Base, which has its own zip code, just because there's too many other, there's other factors that go into that, that often in planning we don't have much control over. It's a separate jurisdiction. So as you can see, the City of Dover is part of the darkest areas and part of the southern part of the county that borders Suffolk County. Now, again, I'm going to give you a little bit of geography here. Kent County is in the middle of the state. There's 3 counties. The northern part is our most populated. Newcastle County, Kent County is probably part of the least populated, but then Suffolk County is where our beach resorts and beach communities are, as well as some of the farming, large agriculture farming. So Kent County is kind of stuck in the middle there. So that's the scan of where our equity values, where the highest values are. Let's go on to the retail food index. So this information we pulled from actually something that's been done before. The California Center for Public Advocacy has done some work on the retail food environment. And so we kind of took that, that approach with this one, and again, taken it to the zip code level where the retail food environment index looks at a ratio of the unhealthy food outlets versus the healthy foods. And so what you see here is you take the sum of the unhealthy foods and divide it by the sum of the healthy food outlets. And we took this by zip code and then trying to make this into an objective measure that we can actually measure over a period of time is that, how do we find out how many fast food restaurants, how many convenience stores there are? Well, the U.S. Census actually provides a lot of that information through their county business, the county business tracking or patterns. And so each of these stores, if they have if they are a business establishment, they have to report to the IRS, and they have they report on census. And so each of these retail outlets has an assigned NAICS code, or North American Industry Classification System. And so supermarkets, as you can see there, has its own code. Produce stands has its own code. So does fast food restaurants and convenience stores. And so what we did was create a table with each zip code and just did a tally based on the NAICS code to get an idea of how many of each of those establishments. And so then we created the formula and then did the math. And then for the farmers markets, that was a little bit more tricky because that tends to be more seasonal. It's a little bit more tricky. So we pulled that from the Department of Agriculture with our states. And so I'm sure many states have this where they have an inventory or a listing of all your farmers markets in the different communities. And you may have that in the local level. Just keep in mind that when I'm talking about Delaware, much of the state agency serves as the local agency. So this, for example, there are no local health departments in the state of Delaware. The state health department serves as the local, just as well as transportation. There are no local transportation agencies. The state serves as the local agency. So with looking at the breakdown of the tiers, so what we're doing here is with the map, when you create this index, we create a tier system where the higher the tier, which tells you the higher need for healthy food availability. So the higher the tier, there tends to be more unhealthy restaurants or unhealthy food outlets. And so we're looking at those higher tiers and trying to leverage that with the equity composite to get an idea of, okay, so here are our unhealthy or our greatest need for healthy food availability, and how does that measure up with our equity composite? And we're still in this preliminary stage, so just bear with us in this one. This is still very new, and we're still tinkering with numbers and with maps, trying to get everything straight. But preliminary, this is what we pulled with the Retail Food Environment Index. And so as you can see, the darker the number, or the darker the zip code, the greater need for healthy food availability. And what we did also in here was to tie in where is our grocery stores. So we put our grocery stores in here. And the idea, again, is this is just to give us a scan of what's existing in our environment, what's existing in the landscape of Kent County and the city of Dover. And so the idea of this is we pull this, be able to identify our priority areas, and then take a deeper dive later on and leverage it with our community info from the surveys. We will be doing planning charrettes this summer to get a closer look at the local level. So again, this is very preliminary as a scan. And so what you see again here, you're seeing that the darker color represents the higher need for healthy food availability. We also put in here with each of these grocery stores, there's a little bit of a bubble. It's hard to see on this map, but if you can zoom in at some point, you can see that each of those grocery stores is surrounded by a half-mile walk shed, about a radius to determine, the walkability of these. And so in some of these, you can see, like in zip code 19952, there are a couple of grocery stores, but in 19943, there are none. So you get an idea of the landscape pretty easily of, where's our grocery stores, and you also can see, there's no grocery store. Perhaps there's opportunities for other healthy food opportunities to go in here in our planning. So then going into the Parks and Recreation density, what you see here, again, this is preliminary. We're trying to get an idea of the amount of Parks and Recreation space that's available for the population. And so in this one, we're taking the density and then we're adjusting it to per 1,000 residents. And so we took the amount of acreage of park space, which is available for our municipality Parks and Recreation departments, which we would already have when we are writing our comprehensive plan. And again, taking it by zip code, what is the park and open space availability per 1,000 people in a given zip code. And so in here, the lower the score, which will represent the higher tier, which means there's a greater need or potential need for more parks and open space. And we have some mapping here for this. Again, this is really, really preliminary here. So it's hard to see in this particular image, but the idea is for us to be able to zoom in closely to be able to identify where is our greatest need for parks and open space. And so the lighter the color represents the greater need or the potential need for more parks and open space. And we also had put in here where our existing trails and parks and open space is located. Then you can see in the lighter shaded zip codes that there is not as much parks and open space available in these areas. You may have pockets here and there, but largely it's very, there's not as much available. And then going to the active transportation density, similarly taking a very similar approach, looking at the distance of sidewalks and adding it with the distance of the miles of bike lanes, and then dividing it by the given area and multiplying it by 1,000 so that we have an idea of a density per 1,000 residents. And then again, we're choosing the zip code again. And to be able to measure distance, there's an article that was published a couple of years ago that kind of provides a methodology, and so we employed that methodology into identifying, what's the distance in miles for sidewalks and bike lanes. And so in here, where the lower the score or the higher the tier represents the greater need for, or the potential need for more active transportation opportunities, whether it be sidewalks or bike lanes or some other multimodal system. And so we're still in the process of mapping this, and then in this map, we like to include those scores per zip code, but also be able to map in here where's our transit stops, where's our road systems, and where's our sidewalks and bike routes. And this will give us an idea of where not only where residents will be living, but also what's the opportunity for them to, or what's the opportunity for us to be able to prioritize where we put more pedestrian or bike networks. And so this is still under development. We haven't, this is pretty much has been done in the last month or so. And so a lot of this work is very, very preliminary and early, and the idea of this is to take this and overlay this where our equity composites, to be able to identify those equity hotspots for parks and open space or transportation or healthy food availability. And with that, so again, what we're trying to do is leverage this scan with our community survey to be able to explore those hotspots, which will be then used in our planning charrettes, which we have scheduled in June and July, where we're planning on identifying hotspots both within the city of Dover and then also with the surrounding Kent County. And again, we'll be able to pull more specific information, whether it be looking at what the residents have said in the survey, but also what does the data say, and then putting together recommendations, whether it be master plans in certain areas to be incorporated into the comprehensive plan update. And with that, that's what I have to present, and if you have any questions, let me know.
Great. Thank you so much, Michelle. So we do have our panel here on the right where anyone can chat in a question. We'd love to hear from their question. But to get us started, I have a couple of questions. So maybe starting with Michelle, since you just spoke. I'm wondering if there's been a challenge kind of on the back end or when you're talking about what types of data to choose between the two different scales. You mentioned some data that's census data and some data that's zip code data, and I'm wondering if you could talk a little bit more about that.
Yeah, so we wanted to be able to have something that's consistent, that we can pull that's consistent across all levels. And so some of the data is available for a census level and a census tract level, and some is just not. And so it's just to level the playing field, we just pulled it from the zip code. And we can pull a lot of the demographics, much of what we need, for, especially the equity factors and identifying the equity, the demographics, those percentages, we can pull easily from zip code data from the census. That's not that simple at the census tract level. Actually, we don't have enough information at the census tract level, especially also when we're looking at more specific health needs, so related to diabetes, heart disease, and obesity, or physical activity levels. We just don't have that at such a small level. We have that more closer to the zip code, the zip code level or county. And just also keep in mind that the state is a small state, and so the zip code is a more feasible option in our case.
Mm-hmm. Okay. Thank you. Somewhat of a similar question for Milena in terms of sources of data and what you recommend for folks accessing data who don't have a university partner. I know that was part of what really helped your project and helped the Active Living Index was some of the data or the support from the university, and I'm wondering if you could talk about some recommendations for people who don't necessarily have that resource in their community.
Yeah, it really depends on the area they want to focus on. There are a lot of data available, and even the CDC is now apparently opening up a little bit the door for having more health data available. So next year there might going to be some surprise coming up from them, at least at the census tract level, which now is still sometimes a problem to have health data for it. Also other government agencies, for example the USDA that Michelle was referring to, are releasing some data only at the census tract level. However, if the scale in which this maybe a project wants to be focusing on, if the scale is very small, for example just a neighborhood, maybe there are different options to have access to certain very local data. For the built environment aspect of it, there is always the MPO. And I want to take an advantage in this moment to acknowledge that our project was extremely important to have as a support our MPO agency for all the built environment data, because ours is very local. And I think a lot of other agencies, unless they are located in rural area, might have access to that. So having the built environment data at the local scale might also be a way to ask collaboration to the local public health, whatever kind of local public health is available on the ground, and see that it can support a certain amount of data, at least aggregated. Because the aggregating strategy is generally where we can overcome the difficulty to have health data. And so that might be an option. I don't know if that helps. Larger geography and larger scale are potentially easy to find information for. It also depends on the population that the project is going to focus on. Sometimes looking at general data is potentially more accessible than looking at specific subgroup, especially children. Children is very complex to find data of, so sometimes the need is there. The project in itself might be tailored a little bit to see on the ground, and I really stress the effort to find coalition on the ground within institutions. School can also be a very good resource if the focus of the project is children. I hope this helps.
Yeah, that's very helpful. Thank you very much. I just realized I'm not entirely sure if folks can chat questions. Just in case you have a question and you haven't been able to chat it to us in the chat box, I invite you to unmute your line. You can press #6 and you can unmute your line and you can actually speak out loud and ask a question. I'll just give a couple of seconds for folks who want to do that to unmute themselves. Does anyone have a question they want to state out loud? Well, I have one more question for both Milena and Michelle in our last few minutes here. Who are you planning to include in your charrette, Michelle? Some of the stakeholders that you'll be planning to include and highlight the results of the equity assessment. And then for Milena, just a couple of stakeholders that you've made sure to make aware that the Active Living Index is available.
So for our stakeholder piece, we actually are leveraging our Delaware Healthy Eating and Active Living Coalition. In that coalition, we have what's called the Environment and Policy Committee, and the Environment and Policy Committee is actually serving as part of the working group, and they are not only a sounding board, but an opportunity for us to share our preliminary work and our progress with them so that they can respond and also provide some feedback. And then we will be leveraging some of them into our planning charrette. So in the planning charrette, we will include not only our local MPO and our planners at the state as well as with the MPO, but also well, like I mentioned before, our state is the local, a lot of the state agencies service the local agencies. So our transportation and parks and recreation, will be involved with that, as well as we will have a public participation, public presentation piece so residents can actually participate as well as the health department. So that's on the top of my head. I mean, that's where we are. We haven't really hashed out who else. I mean, we are partnering as well. You know, myself, Designing for Health, is partnering with DRGA, IDI Group, with providing some of the planning. Will be part of the planning part of the charrette, as well as they're working with our GIS, providing some of the GIS work. But that's, I mean, we're still preliminary, so we're still trying to hash out. A lot of our working group members will be invited to be part of the charrette.
Great. And Milena, just some of the stakeholders that you've made aware of the Active Living Index?
Well, we decided first to acknowledge and have on board in some way our common council, which might sound a little bit unusual, but we thought that if the policymakers first are aware of this tool, they can also trickle it down to their own community. And we actually already piloted in some way with one of our older, and it was very well received. And so that was one of the coalition members that is always, in our opinion, should be on board. At the community side, there are other, I would say, local structure. We call it NRT, so they are Neighborhood Research Team. They are working in our community. They are the most disadvantaged, and we also practically connect with them so they can get directly with the community member and start to use that in the area that potentially are benefit the most. So we started with those two, in some way, extreme tale of the distribution of the decision-making process, but we thought that having those two extreme on board first would it be a better way to reach those that sometimes are not the main focus of the conversation. Third part is we are in the process of developing the new, rewriting in some way, the new comp plan. And I think that's going to be very instrumental for the community engagement at large of the whole city to use this tool for really exploring different locality and different local situations. So,
thank you. That's really exciting that it's going to be integrated into the comp plan and the outreach for the comp plan as a kind of an immediate application. So we do have one last question in the next 3 minutes here. So Randall asked, do you have experience with determining recreation and open space needs in communities that have seasonal or fluctuations in population? And I think that question is aimed towards Michelle. So Michelle, what do you think?
Yeah, so actually I saw that. I actually started typing some of those a response. So in that case, I mean, that's an issue more so in our southern county in Delaware and Sussex County, where you have a good amount of beach communities along the coast. So the approach would be very similar. It's just it'll be factoring in the time of year, similar to what we're actually having the issue with when it comes to farmers markets. Our farmers markets we can't really rely on as a year-round source. So we could break it down by season. So we have, for example, the April to October season, and then looking at that and how that, for example, food access as well as parks and open space for that season, how that would differ from the off season. So we do have that challenge in Delaware in that sense. So we would factor it for a given area for a given time of year. The Sussex County, the population just explodes in the summertime just because of the beach community.
Great, thank you. Well, we're just about at 4 o'clock, so I want to thank everyone for joining us, and of course thank our speakers, Michelle and Milena, for sharing their experience and their process and methodology with us for these really interesting tools. And of course you can explore the Active Living Index with the City of Madison at the link that's in the chat box right now or later on. We'll have this webinar recorded so you can share it with your friends and colleagues. And I hope you all have a wonderful rest of your day.
Thank you.
Thank you very much for listening.